A lot of this is around actually the part of the recovery package, which is now mandated by the government, and certainly is a recommendation of the recent task force that sat with the strategy, I mean mainly for England, but that we should have health and well-being events for people so that they can understand, as you say, what they can do for themselves to support themselves and their family with healthy living, healthy living generally speaking, and that's quite often around diet and physical activity. It's also about understanding what are the likely signs and symptoms of a recurrence of cancer or of the consequences of cancer, so that they can all be acted upon as immediately and effectively. Sometimes there isn't anything you can necessarily do to prevent consequences of cancer, but if you know that they're going to happen and you can report them quickly, then sometimes they can be ameliorated or maybe prevented. But I think the real importance of diet and physical activity in some cancers, there is evidence to say it stops it coming back, but actually it's just about well-being and feeling back in the driving seat of your own life. Cancer can be very disempowering. You become a bit part player in your own life, and to actually feel that you are in control of your life, I think is the most important thing for all of us. That's just not about people with cancer. So that's another thing that we're trying to do a lot of, is allow people to be in control and actually feel that this is a partnership between the medical profession and the person, because they will always be the expert in themselves.